Welcome back to Just the News, No Noise. We've been highlighting a very big problem for our country over the last few weeks on this show, and not many people have been talking about it. It deals with America's pharmaceutical industry because a shocking percentage of our critical medicines are not made here in the United States. So we spoke to Dr., Marine Corps veteran, and Congressman from Georgia, Rich McCormick, about it just before the show tonight. Take a look. Joining us now, a physician, Marine Corps veteran, and Congressman from Georgia, Rich McCormick. Congressman, thank you so much for being here.
Thanks. Good to be with you guys. Appreciate it.
Sir, I know that as a veteran, you obviously recognize what not having the proper pharmaceuticals for our service members is going to do. We had retired Army Colonel Vic Suarez on our show a few times, and he equates medicine to ammo. Is it really that strategically important?
It can be. It's funny. We just had a doctor's caucus meeting this morning talking about a bunch of things we have wrong with healthcare, how we prioritize to solve some of our strategic issues, obviously the cost of healthcare, but also you're talking about an access point. Right now, China basically controls the great majority of basic elements that need to go into medicines. They also have cornered the market on most of the production of cheap and effective medications. That's not good for us strategically. If something happens with our relationship with China, then we're basically cut off from something that basically saves lives. We saw this when we had a problem with Puerto Rico making lactated ringers and saline. It really put us back on that, and when they had the storms there, if you have just one source and you're not able to ramp it up, it can really put you in the grinder when things hit the fan.
Yeah, sir, we knew coming out of COVID that this was a weakness. We saw it in real time during the pandemic, and then Joe Biden's team did nothing. Now, President Trump's gotten in. He's got an executive order. They're ramping up. They're refilling the supply chain. It seems like the next big opportunity is figuring out how to ramp up manufacturing in phases. It takes a while to build a big factory, but there are these micro factories in technology now that can make some drugs quicker and faster. Tell us what Congress is doing to try to push that along.
Well, first of all, the kind of Made in America initiatives that President Trump has been pushing to get production here in the United States so it can't be cut off, so that we are in control of our own destiny is really important. It doesn't mean we only supply here, but that we have the ability to ramp up very quickly. I know U.S. Antibiotics is, for example, a company that produces amoxicillin and augmentin. There's not too many companies that do that, and it's a basic drug, not a huge profit margin. What happens is China supplements their industry with government supplementation so they can undersell the rest of the market and put everybody else out of business. Then they control the market. They also control the basic elements for these drugs, and that causes us a problem too. So basically, we need to make sure that we are prepared so that when the day comes, first of all, that we're able to transition to a harder production scale, but also we have the basic elements to produce the medications to begin with.
Yeah.
That Strategic Active Pharmaceutical Ingredients Reserve, or SAPIR, I guess as everybody calls it, that was created under President Trump. But as John cited, the Biden administration didn't do anything about it. Did they just have a blind spot when it came to putting America first? I mean, that would have been really dangerous if there had been another pandemic, because then they would have had egg on their face. Why didn't they?
You know, the good question why they did a lot of things, especially when it comes to healthcare. These guys didn't prep for anything. They didn't do anything to save any money. Becerris was probably the worst Health and Human Services Secretary of all time. He lost he was a lawyer, first of all, a lawyer in charge of healthcare who lost 4 Supreme Court issues to Texas when they sued him over and over again because he was representing basically big insurance instead of healthcare. This guy was totally sold out to special interests, like a lot of the Biden administration. They didn't care about controlling costs. They're totally bought into the Affordable Care Act, aka the Obamacare, which has not been anything to recognize to affordable. Matter of fact, we had an increase of our premiums of about 30% since that time, with the reduction of reimbursements to physicians by about the same when adjusted for income for inflation, which has forced us into a hospital system that's way more expensive for everybody. Is the single biggest cost to Americans out of your pocketbook, out of your taxes. It's about a $5 trillion industry here in America, over $5 trillion now. Think about that. That would be the size of the 3rd largest GDP in the world, just what we spend on healthcare per year. He didn't do anything to address that. Absolutely a blind spot in their administration, just like so many things else. They were not prepared. They didn't do anything to make us independently, strategically secure.
Yeah.
And by the way, don't forget the oil reserves.
Yep.
We don't have our own oil reserves replenished yet. Think if we go to war right now, we are not ready. And that's all on Biden's head, trying to buy votes by warping the market.
Yeah. Sir, another issue that is parallel to this, we not only have trouble getting medicines to our men and women on the front lines because of the dependency on China, but our system for developing our weapons and our supplies for our troops is so antiquated and creaky, it's broken. You've been taking an extraordinary lead on this. Everyone I talk to is praising the work you're doing. Tell us where that process stands and what sort of procurement system we might be able to look forward to in the next few years.
You know, I just met with the Secretary of the Air Force today. It was a bipartisan meeting, just talking about procurement, talking about which programs are doing well, which ones are not. When you talk about procurement, it always, if it starts well, it ends well. If it starts badly, it ends badly. We are done with the broken process where we're 50%, 100%, 150% over budget, 6 months, a year and a half behind on timeliness. We have really been doing a poor job on this, and the time for those kind of wasteful days is way over. Luckily, we've kind of got our arms around this. Chairman Rogers has been super aggressive in this regard, and I think it's just time to do things right. We got to compete with China on the maximum macroeconomics level of the world right now, and I think we just have to be very careful how we proceed.
Yeah. Sir, before we let you go, I spoke to Secretary Doug Collins a few weeks ago, and what he has been able to accomplish with the backlog of veterans who need care is nothing short of miraculous. As you talk to other veterans, what do you feel like their sentiment is towards this administration? Because there was a lot of fear that was sown with the American people, particularly our veterans, about what this administration was going to do at the VA before they came in.
Yeah, I think the nice thing is you have somebody at the helm who actually understands what's at stake, who has seen firsthand how Atlanta has fallen short. We just replaced our director there. I was just talking to the new director. Super good guy. I was kind of worried because it didn't seem like he had the right experience, but put that to bed really quickly. Putting the right people in the right place. You'll see that some VAs are thriving, others are failing. That's all based on local leadership. They're semi-autonomous, so that's why leadership matters, both at the top level and intermediate levels. Putting the right people in place and making sure that they're not set there like other bureaucracies where you can't fire anybody. We fixed that in the VA, and that's actually making us much more responsive, much more nimble, and a better service for our veterans. And I think that's something we need to do throughout the government, is make sure that contracting is not so that they can just stay there forever no matter what they do. That's the wrong answer to anything in government or the civilian enterprise.
Yeah. It's the opposite of meritocracy and the opposite of what is good for the American people. Dr. Marine Corps veteran and Congressman Rich McCormick, sir, thank you so much for being with us tonight.
Appreciate you guys. Semper Fi. Have a great day.
Thank you.